Okay, let's go.
Do it! Just do it! Jump!
Hi, my name is Nurse Johanna, and I'm here with another edition of CitizenNurse and Friends, and I'm very excited that you're joining us today. And I have a wonderful nurse that I'm going to be speaking to and just sharing what her background is in advocacy. This is a really special connection because we met during the Oncology Nursing Society's Congress in 2024 and connected after one of the advocacy talks that I was giving. So this is really exciting, and this is how like a community comes together and grows. So I have the pleasure of introducing you to Johanna Rochat, and she is an RN, BSN, and OCN, which is an oncology certified nurse. So the theme of the podcast that I've been doing is advocacy and how nurses really fit in the landscape of advocacy and what nurses are doing all over the country. And there is a movement, and finding and building this community is very exciting. I think for a long time, nurses didn't understand or realize that this is something they could do. And people like myself, Johanna, we've had Darcy on, and Alicia, where we kind of felt like we were the oddball talking about these things. And then you meet other people, other nurses, and you're like, oh, wow, you get what I'm talking about. So very excited to learn more about Johanna and what she does as a nurse, and also the things that have inspired her to work in advocacy and the kinds of things that she's doing right now to advocate for patients in the profession. So Johanna, maybe you can give us a little bit of a background of yourself as what you've been doing in nursing and how you got into oncology.
Yeah, absolutely. Thank you so much for having me. I'm so excited to be here and talking with you. It was so nice to connect with you at the Congress and afterwards. So yes, I've been actually in oncology my entire nursing career. I've been a nurse for about 15 years now. I started out inpatient, and it was interesting when I first graduated nursing school. I was like, I don't know if I want to do oncology or like labor and delivery, which are two very different things. But the floor I ended up working on actually had both of those, so I got to try out both. But I stuck with oncology. I've had a couple family members with cancer, so it was really, a personal thing, watching them go through their treatment and things like that. It was something that I knew I wanted to get involved with. And after working on oncology, just the oncology patients are just the most incredible people I've ever met. So I love working with them. And so right now I work in infusion. I've kind of done a lot of different things in oncology. I did inpatient, then I went to radiation, and now I work in infusion. So on the medical oncology side, and I've been doing that for about 7 years now. And I just love the relationships I get to build with the patients and things like that. It's been a really fun ride to get there. And again, just love working with the oncology patients.
My background, even though I've been in oncology a long time, about 25 years, but 16 of those years were in infusion, and I loved it. I mean, it was fun. And that's, I think, a misconception of people going into oncology is they're thinking it's very depressing and, it's just so sad being in it. I mean, you have those moments, but I could never really say it was like truly depressing because it was like a privilege to walk in the journey, walk on with these patients on their journey through getting their treatment. And you get to know their family. I always joke, like, I see the patients and their family more than I would see mine because I'm like, if they're there for daily or weekly treatment, then you build these really strong relationships with them. Never a dull moment in infusion, huh?
That is true. That is true. We have our excitement. And I agree, like the relationships you build, like I work in a smaller office, so I really know every single patient that walks through the door. I know their family members, and I just love that part of it.
So how did you get into advocacy? Like, what was your first experience where you thought, this is something that I want to pursue more, understand more about?
Yeah, so I having been a nurse, we've been a nurse for several years, you start to see kind of the cracks where you're like, why does this happen this way? Or, especially in oncology, you see why can't these people get the care that they need to get, the treatment that they need to get? What's the barrier here? And I feel like I was starting to see those cracks and feeling like, almost powerless to do anything about them. And then I just thought that can't be it. There has to be something. So I just kind of actually went on ONS's webpage and was kind of just looking through their advocacy opportunities. And they had the Hill Day, Capitol Hill Day was coming up. I think this was in 2022. I think it was the first one after COVID. So I was like, you know what, I'm going to apply to see if I can go. I had been like loosely involved with my ONS chapter at that point, but it was right after COVID, so we were still kind of rebuilding. But so I reached out to the government relations director at the time, and he was like, well, does your chapter have an advocacy representative? And I was like, I don't think so. But I reached out to the chapter leadership, and they're like, no, we don't. So if you want to be our advocacy representative, go right ahead. So I was like, great. So I went to the Capitol Hill Day, and that was where I really, got to meet other nurses, like you said, that do this work and are passionate about it, and hear about all the different opportunities that nurses could have in doing advocacy. And I just like fell in love with it. I just enjoyed hearing about all the things that we could change, the legislation that was in the works that I had no idea about beforehand, where I was like, oh, this solves some of the problems that I'm seeing and I really want to like see, improve. And so that really kind of lit the fire under me and got me going to say like, okay, I want to be more involved in this and keep it going.
Wait a second, 2022 at the Yotel, Washington, D.C.
Yep.
I was there.
Yes.
With Lauren Underwood, and she came and talked.
Yes, which was such a cool moment.
It was so cool, and that was actually my first Capitol Hill Day. I know as you were saying, I'm like, wait a second, I think I was there. That was my moment when I walked into the room and seeing all the nurses and realizing, okay, I'm not crazy. Like all these other nurses know that this is important.
Yeah.
And from there, so I was at the California table, and I was actually nervous because I didn't realize that we were going to meet with legislators. I thought it was just like a webinar, a seminar, like, just you would just learn and hear speakers. And then so when I heard that, okay, on day 2, you're going to go to Capitol Hill, and I was like, oh. Had you ever done anything like that prior to that, like meeting with your state legislators?
No, I felt the same way. I walked in and they were like, okay, so tomorrow this is what you're going to be talking about to legislators. And I was like, I'm sorry, what? Like, okay. But at the same time, I was like, great, because I have some things I need to say to them, like
Awesome.
these are important things that I need them to, listen to. And I'm seeing, like, I was the only one from New Jersey. So I was at a table with, I think, some people from the Midwest, and it was just a really cool experience. Like, wow, yeah, all these people from all around the country care about these same things and are here to, bring the attention to them. It was really, what an awesome experience.
I still remember that feeling of walking, to your senator's building or representative's building, and like, were you feeling nervous? Were you feeling like, okay, I got this, I'm going to go in? Like, how did that experience go for you?
Oh, I was definitely nervous. I had never really gotten involved in politics before, so I had never talked to my representatives before. So it was, I think their first meeting was at Senator Booker's office, and it was just like, wow, yeah. A really like important, person. And we didn't meet with him, we met with his staff. And I think going in there, I was so nervous, but then once we sat down with the staff, and it was just like, these are regular people and they trust me. They trust what I'm going to say. They understand, and they want to listen, and they respect me for what I have, for my opinion, and being a nurse and my experience, and just how welcoming they were and nice they were. Great questions that they asked. I was surprised that they had like really good things to ask and listen to my answers. So at the first it was definitely nerve-wracking, but then being there talking with them and just seeing like, oh, this is a conversation. This is just us talking about something that's important to me, and them taking notes and listening to it was a great experience.
I really think that experience like was life-changing for me, knowing that, wow, like nurses are doing this and nurses have been doing this. And I was so inspired. I don't know if you recall, but there were some nurses that were actually instrumental in helping pass legislation in their states, or they were doing like all these wonderful things with like climate change. And I was like, wow, this is really, really cool, because that's how healthcare, I believe, is going to change. Right? There's only so much you can do in your institution, but the change has to come from the outside and going to the people that are making the decisions. This year for Capitol Hill Day, were you part of that as well through ONS?
Yeah. So I was really excited to go again, and they didn't have it, I think, in 2023 because the Congress in 2024 was going to be in DC, and I was so disappointed. But then when they had the extra day for Capitol Hill Days, I was like, okay, I can definitely go to that. So yeah, I got to participate again, which was much easier the second time, kind of knowing what was going to happen and feeling a little bit more confident. It was great.
Like if you had a magic wand and you could improve healthcare, especially oncology care, what would it be?
I would say access to care. I feel really passionate about getting people, especially in cancer care, screenings, access to the top of the line treatments. I don't think anyone should not be able to get the treatment they need because they don't have the correct insurance, or they don't live in the correct zip code, they don't have the extra money, or they don't have the education to know you're eligible for these screenings. This is something that can save your life. So I feel like if I could just, wave a magic wand and make everything, better in one respect, just getting people the care that they need and removing the barriers to that, so that they can have better outcomes, live healthier lives, live longer lives, be with their families. That's the important thing.
That is a very, very wonderful magic wand wish, right? And I think, with more nurses involved in advocacy, I think we'll get there. We just need to get more people, more nurses and other healthcare workers involved and I think we know this, we've learned this from our Capitol Hill Days experience, is that if we're not there at the so-called table, right, making decisions, there's other competing voices that aren't going to take our interests into consideration. And you really have to represent and be there. So what would your advice be for a nurse that is interested in going into advocacy or getting to know more about it?
There's so many different avenues. I think once I got into it, I really realized how many opportunities there were. So I think, your local ONS chapter is a great place to start because you can network with different nurses. And ONS as an organization, really helped me get my foot in the door to kind of see what it was about and learn more about it. But there's lots of organizations out there. So once I started doing that, then I do a lot of advocacy work with American Cancer Society's Cancer Action Network now, because I was like, I want to do more of this. Let me see what else I can do. So if there's an organization that you're like, I really want to support this organization, most of them have some type of policy or advocacy arm so that you can get involved in. So it could be like Leukemia and Lymphoma Society or Cancer Survivorship. They all have these coalitions that all do advocacy work. And so if you have something that you're really passionate about, you can kind of join in those organizations, and they almost always have easy inroads to be like, oh yeah, be a part of this group who does our advocacy work. And so that, and then doing things like listening to podcasts, watching tutorials, those things are all really helpful to just kind of get an idea. Like I love your, stuff that you do on Instagram, because it's just quick little snippets of information that, people don't necessarily know. Our government class was a long time ago in high school. So it's great reminders for, how our government works, what things are. So I think just those are kind of the ways I would start to learn more and get more opportunities to be involved.
What you said earlier about you getting involved in other things, like with the American Cancer Society. I speak to a lot of nurses all the time about advocacy, and it's the same type of journey, because you want to do more, because it's very empowering. You're like, okay, well, I can advocate for my patients or this issue here, but let's see what else I can do. And I think that nurses are really poised to do that, because, we are in this profession where we're very compassionate, and we want to put people, their needs, first almost before ours. I mean, gosh, nurses have such bad habits. We don't go to the bathroom or eat and stuff, but we want to make sure our patients are okay, right? But yeah, I think that rings true for many nurses, and knowing what else is out there, because once you get that momentum of, wow, I can help drive change, and I think opportunities kind of naturally open up, because someone might be like, hey, Johanna is like involved in this. You think she might be interested in this? And it's that really like positive energy where it just keeps building and building, and you meet great people. I mean, I met you through Congress this year, and your missions align, and you learn things, and then you kind of pass it forward or pay it forward, and then more people are in the movement. So that's great. So with the American Cancer Society, have you gone to their Hill Days or Advocacy Days as well?
So I will be going actually in September with them for the first time. We did have a little leadership summit in the spring, actually right before Congress. I went basically from there. I was in Charlotte with them to Congress in DC. Where so one of their big things is Cancer Votes. So they do a big Cancer Votes campaign where they try to get candidates to sign the Cancer Promise. So, and we also do a lot of stuff in the state level, and not just federal. So in March, was it March? Yeah, March we had a Cancer Action Week for New Jersey, where all the volunteers kind of met with our New Jersey state representatives at the local level. So, and we were able to talk with them about, different legislation we really, are asking them to pass. So a big one is biomarker testing. A lot of states have passed some biomarker testing, making it more accessible for everyone, making every insurance cover, the the evidence-based testing, and that is so huge. Like you said, there's been so many advances in cancer care over the years, but it's so targeted, but you have to be able to test for those biomarkers to get the targeted therapy. And so it's really important for the states to all pass legislation that makes, the state funded, the state insurances, Medicare, Medicaid, pay for that. So that was one of the big things we were advocating for. And also New Jersey still has, casinos are able to have smoking in the casinos still. There's a loophole in our smoke-free law. So we've been advocating for that for a really long time, trying to get that closed. But we're up against some big guns there. So, it takes a lot of talking and consistently reminding our legislators about what's important and the research that's out there. So yeah, I was able to do that with them. That was the first time. I've been with them for, a little over a year now, but it's been a great experience. Just to give me, exactly like you said, you build momentum, you get excited about the change that you can make. And I think that is so helpful for nurses, because we get to this point where we can get frustrated and you can get burnt out and say like, nothing is changing. Everything is staying the same. It's not working. I see these problems. And you can either accept that and just be like, whatever, I'm just going to either leave or I'm going to, not worry about it. Or you can say like, no, I'm going to do something about it, and I can do something about it. And so getting involved in the advocacy really helped me see like, I can make a difference. Like us as a group can make a difference. And then when you see that, like you said, you just kind of like, oh, I want more of that. I want to see more change.
Yeah, and then you pull in your friends and you're like, let's do it together.
Exactly.
But I want to thank you too for your campaign, and on LinkedIn. I'm glad that you put it on there, because then it's I didn't know that was something that the American Cancer Society was having. But was it like Light the Night, or what was the term for it? But you're doing this project.
Yeah, it's called Lights of Hope. So what they do is kind of one of their fundraising campaigns, but also legislative campaigns. So what it is people can donate money to decorate bags in honor of either a family member who's passed, or a caregiver, or in honor of someone who, went through cancer treatment and, is a survivor. And so you could decorate these bags, and then when we go to DC into September, we bring the bags and put them at different places. So like last year, I think it was around maybe the World War II Memorial. And so they just line it with, thousands of bags that are all lit up. And it's just such a powerful message to Congress, I think, because it just shows, look at all these people's lives who have gone through cancer, have been touched by some kind of cancer treatment. It's a really powerful reminder of how important it is to fund cancer research, to support cancer policies and access to care things. And so I'm really excited to go in person this year and see them all lit up. And it's a cool way for people to honor loved ones, and then see that donation and that message is being sent to people who can make changes and can do the big asks that we're asking them to do.
Thank you for your work in that. And I donated on behalf of my father, who passed away about 10 years ago. He had colon and then a secondary cancer. It was like a surprise cancer, one of those. It was adrenal gland and colon, and it's. The reason I got into oncology was because my dad was diagnosed a long time ago, and I think for most people, that's kind of what interests them, is because they have a family member, someone close to them that has been touched by cancer. But thank you again for doing that. And would you be able to take some photos, and maybe you can send it to me? I can highlight it on my social media.
Absolutely, I would love to.
Thank you so much. And also too, I think nurses may take for granted that we do live in a country where we can speak about issues like this and advocate. And like you said, you're gonna put these bags as a statement, as a symbol, there, so it's a visible reminder of what how cancer has touched this country. But there's not other countries you can do something like that, right? So we even have the privilege to do this, and we have to exercise the right to bring awareness to these issues that are going to make our healthcare system better. So thank you for doing that work.
It's really my pleasure. I love it.
And I look forward to more of the work you're going to do with the American Cancer Society, and it just, goes hand in hand with the Oncology Nursing Society. So I think important for nurses to know, if they might think about, going to Washington, D.C. or talking with their senators, if that sounds very daunting, you can always start at the local level, like you said, state level. There's so many issues you can tackle from there, or even in your county, in your town, get to know your representatives. And it may not necessarily have to be about healthcare, maybe you think there's a street corner that needs a stop sign because there's too many accidents. I mean, I've seen people advocate for that and talking to their city councils and all that. So
even if you're like, oh, I don't want to meet someone in person, And, there's so many ways you can just sign a petition, you can send a letter, and they make it so easy where all you do is, fill out a little form and say like, yes, I support this. Like, please, I'm asking you to support this as my representative. There's so many easy ways to just kind of tell your representatives, like, please support this bill. This is why it's important, without having to do the face-to-face and things that maybe not everyone's ready for.
One of the easiest ways you can be involved is make sure that you're registered to vote. And, when the time comes, make sure you vote. I mean, that's just a kind of like a foundational, easy way. Like, it's not a lot of commitment. You're just registering and voting and reading the issues, of course.
Right. But even for not just the, high level, like president, obviously everyone's talking about the presidential election and even Senate and all those, but there's lots of local elections, like you were saying, that happen as well. And those people make a lot of decisions at your, state level, at your county level, who has access to what, how much is covered by Medicare or Medicaid, and what kinds of things you can do. And so I really encourage people to also, look at all those people that are running on, lower parts of the ballot, because they do really impact your daily life.
Yeah, the local level things actually, they would have a more tremendous impact to your daily life as opposed to, the bigger federal things. Because, there's the federal and the state and all of that. But the local level, they affect schools. They affect, what's in your local grocery or, things like that. So very important to get familiar and be aware of those issues. As far as nursing skills, how we deal with our patients every day, how we approach our work. Can you call out one or two nursing skills that are applicable in advocacy or, talking to your legislators or policy making?
Yeah, I would say definitely we learn how to talk to people, right? And kind of sometimes you have to learn whether people need kind of a soft approach or a more direct approach, and figuring out how to kind of convince people to do what as the best thing for them. As nurses, we're constantly like, I know it's not great to take this medicine, but this is why it's important. And so I think that translates when you're talking to a legislator, like, I know this is difficult because of this reason, but this is why it's important. And, these are all the research that's behind that. Nurses are always going off of evidence-based research. And I think a lot of the policy and advocacy work that we do is looking at, hey, this is the research, these people are getting left behind, or this biomarker testing is really important for this targeted care. I think the important thing to remember is, especially same thing with our patients, they don't know the medical side of things. They don't understand all the nuances. And, even your legislators are very smart people, but they don't have your background. They don't have a lot of times a medical background. So when you're talking about biomarker testing, they're going to be like, I don't really know what that is. But if you, same way you talk to a patient and kind of explain, the importance, what it is, it's the same way you talk to a legislator and just say, like, targeted therapy, you want whatever treatment you're getting for your cancer to be the best for that type of cancer, right? And then explain how the biomarker testing helps that happen. I think all of that you learn as you start talking with patients and learning how to kind of have those conversations really translates well into when you're having those conversations with legislators.
Oh, yeah, that's very true. Very true. And like you said, nurses, we teach our patients every day so that they can do what they need to do in order to get better when they're discharged, right? So it's an easily transferable skill set when talking to your legislators. And it's so wonderful talking to you. I know we set this up a couple of weeks ago, and I say this a lot, but it's really true. Like, everyone I speak to, it's like so inspirational for me to hear people's passions and how nurses are basically, I'm going to say how nurses are going to save the world. It takes maybe one person at a time, but there are so many of us in this country, and we are we're the front lines almost in terms of what patients are experiencing every day, or there are people that have experienced health issues and they want things better for themselves and they want to advocate as well. So thank you so much, Johanna. This has just been a wonderful talk. Is there anything that you want to share with anybody watching this that might help them, get their foot across the threshold into the advocacy journey?
I would just say, it's probably one of the best things I ever have done. Like you were saying, going to that Capitol Hill Day was life-changing. I feel the same. It was just a life-changing experience. Listening, especially, they had talked about the lymphedema bill, where they had worked for years to get Medicare to cover the lymphedema garments, and how inspiring it was to see all these people that had advocated for years to get that done, and it finally passed, and it was so exciting. And I think for anyone who just really wants to see the change and wants to be a part of that, like you can do that. It sounds like, oh, can I really make a difference? But meeting you, hearing and seeing like they're talking about advocacy at ONS, all these other coalitions have advocacy arms because, like you said, if you're not at the table, no one is going to advocate for you or for your patients. And I feel like that's why I do it. I do it for the patient. These people are already going through treatment. They're trying to work and care for their families and get through cancer, and they don't have the time to go to meet with their legislators necessarily and talk about all these things. But I can do it because I hear those stories too, when they're in my infusion chair. And so, just being brave enough to take those patient stories to your legislators and know that they listen to you, it makes a difference. And like you said, we'll save the world.
Yes. Yeah. Oh my gosh. I know, like I'm smiling almost ear to ear. Just like you just made my heart so full right now, just with everything you've said, and just so inspiring. And I'm looking forward to all the amazing things you're going to do for your state and for oncology. And I might have this as a regular series. So if you have anything coming up or want to share about, please reach out to me. I'm always happy to have this platform open for nurses and have it available on YouTube. And this is like a different way of grassroots advocacy. Is like we have to leverage our social media and digital platforms, right, to get the message out there. But thank you so much, Johanna. It's been a pleasure just chatting with you.
Thank you so much. It's been a pleasure for me too, and just I appreciate all the work that you're doing and just getting these platforms out there, because I think nurses don't know what's going on, and so they can see oh, these people are doing this too, and the more we can kind of build that momentum, I think the bigger change we can make. So I really appreciate you taking the time and doing this. I think it's great, and I'm so excited to be a part of it.
Thank you so much.